The recovery after a total knee replacement is tough and can be overwhelming. You're going to be hit with a smattering of information in a short amount of time. All of that information from handouts and pamphlets are more likely to go into the trash than in your head. This can make it tough to appreciate exactly what to expect going forward, which can be scary and frustrating. Well, as your go-to rehab guide, I'm here to help ease your nerves and help you understand exactly what you need to do to get through rehab. And if you would like to share your experience after total knee replacement surgery, leave a comment below. I would love to hear your thoughts. Before we dive in, please note that this video is a general overview of the recovery process after total knee replacement, and it's for educational purposes only. The timelines are an estimate, and the rate of recovery will vary based on the individual. Listen to what your physical therapist and surgeon says. They will have more individualized answers for you. So without further ado, let's get rehabbing. Pretty much right out of the gate, you're going to be asked to start moving and putting weight through that brand new knee of yours. Your therapist will assist you in getting out of bed and using a walker to get around safely. You'll also learn how to navigate stairs before you head home. Who knew a couple of steps could feel like you're climbing Mount Everest? Depending on your progress, you may be discharged to receive home physical therapy or be required to stay in an inpatient rehab setting until you can move around more easily. It's important to keep an eye out for signs of infection and blood clots over the next month or so. Infections can cause you to experience fevers, chills, and night sweats, and your incision may look more red, more inflamed, or leak pus or fluid. Blood clots may not always have symptoms, but you might notice new swelling in your lower leg that doesn't go away, as well as pain or tenderness in your calf or thigh that is unrelated to your incision. If you experience any of these signs or symptoms, be sure to let your therapist or doctor know so it can be managed properly. It's nice to be out of the hospital and in the comfort of your own home, but you're going to be feeling very raw over the next couple of weeks. The focus in this phase is to manage pain and swelling, regain mobility, and restore control of the muscles in your leg. Make sure you're following through with your prescribed medications, and make best friends with your ice pack to improve tolerance to moving and improve your sleep quality. I recommend icing 3 to 5 times a day for 15 to 20 minutes at a time. Elevating your legs while icing is a nice combo to manage the swelling that you definitely will have. Despite the soreness, it is essential you keep that knee moving. That may sound counterintuitive due to the pain you're having, but you're not doing any damage. Pain is just pain at this point. The worst thing you can do is leave that leg in one position and cause it to tighten up. Make sure you're bending it frequently, multiple times a day. A big thing to avoid is placing a pillow underneath the knee when you are resting or sleeping. This may feel good at the time, but it leaves your knee susceptible to stiffening up, reducing your knee's ability to straighten out fully. Your knee needs to be able to straighten out in order to walk normally, so keep the knee straight when lying in bed or on the couch. Throw that leg up on a coffee table and drape a book or an ice pack on it to add a little extra weight, and let gravity go to work. Do this a couple of times a day for 5 to 10 minutes, and it should straighten out in no time. It's not going to feel great, but you will be happy with the results. You will likely be cleared to receive outpatient physical therapy after about 2 to 3 weeks of home physical therapy, depending on how safe and effective you are leaving your home. Depending on if you're still on opioid medications and which leg was operated on will dictate when you can drive. People who receive left total knee replacement can usually drive within 2 weeks after surgery, as long as the car is an automatic. Those who receive a right total knee replacement can usually drive around 4 to 6 weeks, depending on your reflexes and strength. While you focus on getting back your knee mobility, you will also be performing exercises to improve control of your quadriceps muscle, which gets weak due to the procedure. Signs of good quadriceps control is if you can do a straight leg raise for 20 repetitions without knee bending. You will also notice less instances of knee buckling when you're walking. Utilizing an electrical stimulation device can be very helpful in giving a little input into the muscle to help it contract. If you're having a tough time contracting your quadriceps muscle, ask your therapist if they have an electrical stimulation device that you could use during the first couple of weeks of rehab to get it firing. By the end of 6 weeks, you should be able to bend your knee to at least 100 degrees and straighten it out completely. If you're not at these measurements, you may be required to undergo another procedure, which could include the surgeon going back in to remove scar tissue and potentially forcefully moving your knee to loosen it up. You will want to avoid this. So again, move that knee and often. At this point, your pain and swelling may still be present, but should be much improved. Continue to use ice as needed to manage pain after exercising. And if it hasn't sunk in by now, let me be perfectly clear. Move that knee. Continued improvements in knee flexibility will allow you to perform activities such as squatting and stairs more effectively. The primary focus of this phase is about improving your quality of movement with daily tasks, as well as restoring muscle size. You should be progressing off any assisted device by this point, or continue to use a cane for balance as needed. As the weeks progress, you will begin to do more challenging exercises that focus on building muscle in your legs and improving balance. By the end of this phase, you should have around 120 degrees of knee flexion and be able to fully straighten your knee. If not, keep working on it. There are some cases where full knee motion is not expected, so ask your therapist or surgeon if you are concerned about your mobility. Swelling and pain should be minimal or completely gone by the end of this phase, and you should have some really good strength in those legs of yours. You should be able to walk without a limp, and stairs and getting up from a chair should be no issues. If these goals are achieved, and you are able to perform daily activities with good tolerance, you will likely be discharged from therapy to continue with a gym-based exercise program to maintain flexibility and strength. If you are experiencing slower progress or want to return to more demanding physical tasks, a longer rehabilitation course may be beneficial to continue to promote strength and tolerance. Unfortunately, it is unlikely you will be able to participate in higher impact activities due to the wear and tear on your knee replacement. But other low impact exercises, such as swimming, golfing, and cycling, are great modes of exercise that place less stress on the knee. Well, I hope this provided you a better idea as to the rehab process after total knee replacement. If you liked our video, we would really appreciate you giving us a like and subscribing to our channel to help us continue to grow. If you are interested in more total knee replacement content, check out these videos.